Okay. Now, welcome to another discussion about mental health, and today's discussion is going to discuss about bipolar disorder. So, bipolar disorder in Nigeria was called manic depression, and it's a mental condition characterized by extreme mood swing, and these mood swings can range from either a very deep depression and manic high, and unlike in normal up and down every day most people go through, this one types of bipolar disorder can be very severe. So it becomes a little bit difficult for somebody to differentiate them from the normal up and down of daily activities because this one have a very extreme appearance. So globally, the epidemiology of bipolar disorder is approximately 1% in the population, and affect men and women equally the same, from all the way from teenager and early childhood. So the onset is very common in these crucial pieces of life, and can have substantial effect on either the productivity of people in their their day-to-day activities, and also it can interfere with somebody's career, and also it can interfere with somebody's education. So this means that early diagnosis, early intervention makes a long-term and good improvement outcome out of this. So these conditions are associated with stigma, social stigma in the community, and lack of awareness can delay a diagnosis and a treatment, which can also complicate to other things in our community. This one can make somebody have a low production at the place of work, and people can have a low productivity in quality of life, either at the place of work and all those ones. So especially if it is associated with it is compounded with other medical conditions like a pregnancy or any other mental conditions, also can have some issues in diagnosis and also issues in management as a result of delayed diagnosis. The complexity of these bipolar disorders make it a little bit challenge to treatment, and so the treatment requires a well-planned, comprehensive management, which should have a multidisciplinary approach depending on various stakeholders and various players in this management of this one, because it will require some psychotherapy, it requires lifestyle changes. So creating awareness about the stigma surrounding bipolar disorder is very, very important. So in this case, the patient will require a complete community support in all perspective when you're dealing with bipolar disorder. So there are basically three types of bipolar disorder. There is bipolar 1, which involves at least one manic episode that lasts for at least a week or more. There is type 2, which include history of depressive episode but less severe manic episodes known as epimania. There is the other one, which is called cyclothymic disorder, which features both manic and depressive symptoms, but it's less severe form of bipolar disorder. So bipolar 1, bipolar 2, and cyclonic disorder differ not only in the symptoms, but also in severity, and also the mode of treatment approach is very different, and it affects activities of life. For example, in type 1, bipolar may require hospitalization during severe manic episodes, whereas type 2 we may undergo and diagnose for a period of time, and the symptoms are slowly accumulating, and which can be mistaken for moodiness. So the cyclonic disorder, on the other hand, tend to be chronic and enduring, but its symptoms are not severe enough to warrant a diagnosis by type 1 and type 2. In this case, cyclonic disorder type of bipolar can go undiagnosed for a period of time, and they can have a long and difficult time to diagnose them. So it is very important to have a proper diagnosis and a treatment of these bipolar disorders so that we can improve the quality of life of these people who are suffering from this one, and also to prevent the stigma in the community. So the key thing is that the understanding of these three types of disorders of bipolar, that is type 1, type 2, and cyclomic disorders, because the treatment and the approach and also the clinical symptoms are very different. So signs and symptoms of this condition is that they can vary differently from individual to individual, and depending on the environment you are living, and also the compounding factors of other conditions can be a very great factor which contribute these signs and symptoms. So, for example, during a manic phase, one may experience a elevated mood, inflated self-esteem, and also may have a reduced need for sleep. So they have what is called sleep apnea. So, and just know that sleep apnea can result to cases like diabetes, can result to cases like hypertension. So depressive phase symptoms can induce low mood, feeling of hopelessness, and loss of interest in activities. So misdiagnosis can lead to inappropriate treatment, making it crucial to consult a healthcare personnel for comprehensive management, especially either a psychiatrist or sometimes even a psychologist can arm in and then diagnose these type of conditions. So understanding these things is very essential for the clinicians and the general public, so that they can understand each subtypes and so that they can be able to have a very good way of treating it, and they can have a cumulative type of treatment options for this type of people. So in management of this one, so type 1 involves strong medications to control the more severe manic episodes, and whereas type 2 may focus more on managing the depressive symptoms. It's also worth noting that the different types can also vary impact on the relationship, and also can vary the career, and also well-being, and also the treatment should be tailored to all these factors like relationship, career, education, well-being, and other conditions, social health respect, all of them should be considered in this type of condition. So public misunderstanding of these subtypes can lead to generalized stigmatization of the people surrounding bipolar dysfunction. They can be mocked by other people, which is very wrong. So public education, public awareness, public promotion about bipolar disorder is very important, so that we can have a long way to reduce the stigma and make a room for new discussion about mental health. We can have a platform for discussing about this mental health by ensuring there is a long-term public health promotion about this time, creating awareness about these conditions so they can be able to understand this type of conditions, so that we can have full participation, community participation in each and every dimension in management of this condition. So the treatment options for this type of condition is that there is so many psychotherapies like psychotherapies like behavior therapy, cognitive behavior therapy, and also we can also have a family focused type of therapy in managing this type of thing. It requires a supportive environment for treating of these type of types of treatment, where it involves the people at the place of work and the people of the school. Then if it is a child, if there's somebody who is going to let the teacher understand this patient is or this child is suffering from bipolar disorder, so that they can be assisted. On drugs, we can use mood stabilizers and other antipsychotic medications, and also a supplement of psychotherapy in this treatment of bipolar disorder. So having a very good supportive system in the community, in the school, in regional setups, in social places is very crucial, so that it creates an enabling environment for healing, for diagnosis, and coping up with life resilience in people who have bipolar disorder. So this one can minimize the risk of severe episodes and complications, So family support and emotions is very important in this type of people, so that you can reduce even the trigger factors in this type of this type of people. So the goal of this one is to establish enabling environment for each individual, so that they can have a productive life, a well-rounded approach that include medication, therapy, community participations, and the public participations in well-being of these people. So the key thing is that reducing a stigma surrounding bipolar disorders is very important, because it can lead, and bipolar itself can aggravate the problem, and also can make the treatment not be able to be treated properly.